You can clearly see the posterior dislocation of the knee consistent with this sledding injury, which occurred when the impact of the sled applied direct force to the anterior tibia while the knee was flexed. Injury to the popliteal artery is not an uncommon complication and can lead to
Relax. Dr. Ben doesn't expect that much from me.
Reduction of the knee should be attempted using analgesia with horizontal traction and realignment of the joint. Angiography should be considered with attention paid to the 5 Ps. Pain, pallor, paresthesias, pulselessness, and paralysis.
All right, who's next? Carter.
While attempting a rollerblading maneuver, this 12-year-old male fell on his outstretched right hand, resulting in a Salter-Harris type 2 epiphyseal fracture of the proximal humerus. To avoid damage to the growth plate, the humeral head, which is in varus angulation and external rotation, must be reduced by abducting and externally rotating the arm, and then slowly bringing the arm down. If the reduction is not accomplished, then the arm must be maintained in a cast in the Statue of Liberty position.
Is that it? Any questions? Ms. Chen.
You do great.
Here. Facial fractures. You'll find an outline and recent research articles. Should pass it down? Here we see examples of a depressed fracture of the left frontal bone with disruption to the orbital rim. Both the result of blunt force trauma when the patient's face intercepted a tire iron. Oh, John, if you would please, the projector. Yeah. Thank you. Orbital rim and frontal sinus fractures, along with other fractures to these facial bones, often result in concomitant CNS injury. Diagnosis is established with radiographic studies and computerized tomography, preferably using a 3-dimensional image of the patient's skull. As you can see, the frontal sinus and orbital rim fractures here are easily appreciated.